Okay, I see that Dr. Baumgarten is on, and I believe we're just waiting for Dawn Peavy. All right, everybody, it looks like we have our spokespeople here now. We appreciate you joining us today. I'm Nicole O'Malley. I'm with the PR team at Ochsner. We wanted to give an update on Omicron and testing, as we've been getting some questions from around the state. So with us this afternoon, we have Dr. Catherine Baumgarten, who's an infectious disease specialist and the medical director of infection control and prevention for Ochsner Health. We also have Dawn Peavy, who is an RN by training, and she is our Chief Executive Officer for our Centers of Excellence and service lines at Ochsner Health. We will, of course, make sure to be sending you their names, the spelling of their names, their titles, and a recording of the briefing once we're done. So we'll make sure to follow up with all of that information. So with that, I would like to turn it over to Dr. Baumgarten.
Hi, good afternoon, everybody. Thanks for being with us today. I'm Catherine Baumgarten. I'm the medical director for infection prevention and control at Ochsner Health. Good to see all of you. We just wanted to give you an update about Omicron today and also answer any questions that you might have. We do know that we've been following this since late November. And unfortunately, over the past month, we've seen that the Omicron variant is now the dominant strain in the US, with the CDC reporting 73% of new infections last week were due to Omicron. It also appears that this is the case for Louisiana, and we've gone from 2% of sequencing being positive to 32% of sequences being positive for Omicron in only a week. The CDC showed that the numbers have nearly a 6-fold increase in Omicron's share of infections in only 1 week. So we, of course, want to share what we would like people to do to try to prevent additional spread of Omicron and prevent additional people from becoming ill, becoming hospitalized, or even dying due to COVID. We do know that vaccines work. We continue to talk about vaccines. This has been our primary message for a number of months now. But even with Omicron, we know that vaccines work and keep people out of the hospitals and prevent deaths. We also know that the vaccines that we have available when boosted can increase somebody's immunity to Omicron and to COVID in general. So we know that these vaccines work and increase those virus fighting antibodies. We're encouraging everybody to get boosters. We would like them to get boosters now. I've gotten a lot of questions from people as to whether or not they should wait to get boosters, because I think there's a lot of information out there that perhaps there will be a new formulation of a booster. But we want to be sure that people get boosted now. Those new formulations should take several months. And so it's important to go ahead and get the protection that's available now. In terms of the boosters that are available, we know that the Pfizer booster can be given to those ages 16 and above at least 6 months after that initial 2-dose series. And Moderna can be given to those 18 years and above, to those that have also gotten that initial 2-dose series, and that's given 6 months after that last dose. And then if somebody has gotten a J&J vaccine, the booster is given 2 months after that initial J&J vaccine. All of the boosters have shown to have increased levels of virus-fighting antibodies when given. We know that Pfizer's booster shot increased people's levels of virus-fighting antibodies by 25-fold. We know that Moderna's current booster is found to increase neutralizing antibody levels against Omicron by 37-fold compared to pre-boost levels. So if you're not vaccinated, now's the time to go do that. We want to make sure that families, when they're getting together, are boosted. We want to be sure that they're giving the gift of a booster. They're telling their family members, hey, let's go get a booster shot before we're getting together for the holidays. We'd also like to share with you our hospitalization information because we know that it's important to know how our hospitals are faring, especially as the holidays come up. And we know that the hospitals, have been stressed with prior surges. So LDH had reported 2,341 new confirmed cases yesterday of COVID, but the hospital levels remained relatively stable. We have seen a trend towards increased numbers of hospitalizations, but not as severe as we had with prior surges. We are continuing to track this data. And we do know that while we had about 1,074 patients at our peak of the fourth surge in August of 2021, now across our system, and that includes Louisiana and coastal Mississippi, we had 78 people hospitalized as of today. And for reference, we had 51 hospitalized 1 week ago in that same locations. We also want to share how many pediatric patients we have hospitalized across our system. There are 5 total. We have 1 on the South Shore, 2 in Shreveport, 1 in Lafayette, and 1 on the North Shore. So we also understand that people want to know what they can do over the holidays. So we want to share our thoughts about what people should know when they're gathering this week and over the holidays, including Christmas and New Year's. So the first message, and we talk to our employees about this all the time, is to stay home if you're not feeling well. If you feel like you're having symptoms, no matter how mild they are, stay home and seek testing. There are home tests available now. We want to be sure that people can get those tests and stay home instead of going out and about and spreading germs to other people. The second message is to get vaccinated or get boosted. We know that those vaccines prevent serious disease, hospitalizations, and death, and our vaccines are available now from ages 5 and up. So if somebody hasn't been vaccinated, the biggest gift you can give them is taking them to get that vaccine or encouraging them to get that vaccine. And if you have not gotten your booster, please go encourage others to do that and do it yourself as well. The other good news about this holiday season is we are in the South and we are going to have a warmer Christmas. So rather than congregating inside, people can congregate outside. We know that being outside is good and helps prevent COVID. So you want to mask and celebrate outside. If you are going to have an indoor celebration, it is prudent to mask indoors as well. You don't need a mandate to wear a mask. We know that masks work. It's clear from the data. And so everybody that's gathering should be wearing a mask indoors. Still celebrate, but just take some precautions. At this point, I am going to turn it over to Dawn Peavy for some information about testing.
Thanks, Dr. Baumgarten. So as mentioned, we are seeing an uptick in the prevalence in the community, and that is driving an increase in demand for testing at all of our health centers and clinics. Last week, we completed, or in the last 7 days, we've completed nearly 20,000 COVID tests in the community, which is about a 30% increase over prior week. In response to this, we have increased our number of community locations and reinstated a number of our drive-through locations across the state and through coastal Mississippi. All of those locations can be found at ochsner.org/testing. We are administering PCR tests at those locations, which is the most sensitive test that is available, and test results can take up to 72 hours to come back. Those results are released into a MyChart record if the individual is a member of the MyChart portal or by phone. And then for community members in Lafayette, you can find your results through your MyHealth, or more information is available on the Ochsner Lafayette General website. In addition, we are recommending that people take at-home tests. And so at-home tests are available in most major retailers. Those tests are reliable And we actually use that same test in areas of our healthcare system because we do trust it. And so we encourage you to use at-home tests if they're available, or to seek those for your family and friends, rather than going into urgent care and emergency departments for testing. So if you take an at-home test and you test positive, it is important that you immediately start your isolation and your quarantine. And so you want to stay home for 10 days per the CDC guidance, and make sure that you're using good hand hygiene practices. If you have symptoms, then we encourage you to treat your symptoms the same way you would if you were not COVID positive. So if your symptoms include that of a headache, whatever you would normally take for a headache, ibuprofen, Tylenol, go ahead and take that. Same for cough or mild symptoms. So we encourage you to just use the same things that you likely already have in your home or over-the-counter medications to treat your symptoms for mild symptoms. If you have more extreme symptoms, then we recommend that you contact Ochsner on call at 866-703-7790. When you contact Ochsner on call, your clinical situation will be triaged, and they will route you to the appropriate level of care based upon your individual symptoms, which could include a virtual visit, urgent care, or the emergency department as needed. While you're home, we do encourage you to drink plenty of fluids, take over-the-counter medications as mentioned, and then 2 items that will come in handy at home is a thermometer and a pulse oximetry. You can buy those both over the counter. We encourage you to check your own pulse ox, and as long as it is above 94, you should continue to treat at home. If that number drops below 94 consistently, then reach out to your healthcare provider, call Ochsner on call, or we do advise that you seek medical treatment at that point. Of note, the community testing locations that we have stood up are no out-of-pocket expense for community members. So that is another option in addition to your home test. Again, all testing locations can be found at ochsner.org/testing. We continue to watch the demand very, very closely and stand up additional testing centers as needed. So if you go to the website, that's where you're going to find the most recent updates, locations, and hours of operation for your convenience.
All right. Thank you, Dawn. Thank you, Dr. Baumgarten. With that, we will open it up for some questions this afternoon. You can put them in the chat, or you can come off of mute. All right, I see a question just came in the chat from BR Proud, and I think Dr. Baumgarten, if you could take this one. How do you identify a variant, and is it necessary to know which variant you test positive for? Are there different symptoms for Omicron?
Sure, that's a really good question. So our routine tests that we perform do not tell us whether or not COVID is a particular variant or not. The way that we do that is we send it for specialized testing, and we partner with the Louisiana Department of Health to do that. So we take a certain number of samples and submit those to the Louisiana Department of Health and our sequencing sites. And then we're able to determine out of how many samples we have, how many of those are Omicron or how many of those are other sequences. So we do not do that sequencing test though for an individual patient. And I think that's sometimes confusing for our patients because they come in and they want to know, do I have Omicron? Do I not? Do I have Delta? What do I have? And we can't tell them that in that moment. And then when we do the sequencing, it's more of a general sequencing. So it's not an individual result. But we do know that Omicron is circulating right now in our community. And so we do think that most of the cases that we are seeing circulate are going to be Omicron.
Thank you, Dr. Baumgarten. Is there anything that you can speak to in terms of symptoms for Omicron that might be different or anything you've seen?
Sure. So the symptoms for Omicron, we are being, we're looking at that data and it's ongoing, but from initial studies, it looks like they may be milder. But again, we're trying to keep a very close eye on those hospitalizations, and certainly in some people that are at risk for severe disease, there will be more serious illness, but in general, it appears that those symptoms are milder. And in vaccinated and boosted individuals, we know that those symptoms look like they're milder as well, which is good news. But there is not a good way from symptoms to tell what sort of virus it is either. You know, sometimes the flu can look like COVID, or other viruses, the cold viruses can appear to be like COVID, which is why we encourage testing. So even if somebody has a stuffy nose or new symptoms, we would want you to stay home, get tested, and then with those results, if your results are positive, we have the ability to do a virtual visit, Ochsner on call, if somebody's ill enough to come in to seek treatment if they're ill. But it is a good way to know whether you have Omicron versus something else, to do the at-home testing for COVID. I'm sorry, let me rephrase that. It's good to know whether or not you have COVID from the at-home test, not specifically Omicron.
All right. Thank you. And I saw a question about how many cases of Omicron have been reported in Louisiana. That's something that really the LDH would have to provide that number on. So would really refer you to Louisiana Department of Health. Another question that's come in, are patients asking if they should cancel gatherings or screen to see who is or is not vaccinated? What are you advising?
I think that's a really good question, but it's also one that I think is really challenging right now. My best advice is to make sure that everybody attending is boosted and that everybody is testing. If not, and it's actually anybody that has symptoms should be testing. So it's a good idea to test, to be vaccinated, and then in indoor gatherings to wear masks if you're in a larger sort of group. It's always good to have good ventilation. And you have to take the individual person in mind. So my advice would be for somebody that maybe has risk factors for COVID or might get more serious disease or may not mount a good response to the vaccine, to be very, very careful. And you might want to consider rescheduling a larger gathering to a time when there's not as much positivity. But testing and vaccinating and masking are all ways you can reduce that risk with any gathering.
Thank you, Dr. Baumgarten. I see we have another question about hearing different numbers for the rate of Louisianians who have gotten boosters. Do you have the stats for this? I think we would be able to provide like the number of booster shots we've given as an Ochsner health system. But again, I think LDH would have the numbers for statewide data for boosters. Another question, any message for those who received the J&J booster before the new CDC recommendation?
So for those that got the J&J booster, there aren't any additional recommendations at this point from the CDC. So we'll have to stay tuned and see what the data shows, and then see what the recommendations are from the FDA and then the CDC. Remember that most people that have gotten the J&J vaccine would have gotten a J&J booster 2 months later, or they could get an mRNA vaccine as a booster as well. So they could get Pfizer or Moderna for that second dose if they so choose. So there are a few options for those that got J&J. But if somebody's gotten 2 J&Js, at this point, there's nothing further recommended by the CDC or FDA. All
right. Another question, how is the capacity at your hospitals right now? And specifically, how is the capacity at Ochsner Lafayette General? Is there space for an increased number of COVID patients?
I'd say the capacity at all of our health systems continues to be pretty close to full, given not necessarily with COVID patients. I think we've shared those numbers with you, but with non-COVID patients, continuing to seek medical care. And so we are being proactive about how do we create additional capacity, like many in the state and across the country. staffing is the biggest challenge in the hospitals right now. So we continue to look at opportunities to bring in additional staff resources to open new capacity in anticipation, should we need it, of any COVID inpatient surges. So specific to Lafayette, I don't have their census in front of me today, but I would say the statement that everyone is pretty close to full and working to proactively create capacity is true really across our entire health system.
Thank you, Dawn. And we will share the number of COVID patients currently hospitalized by region as a follow-up to this briefing. So I know Dr. Baumgarten shared that we have 78 COVID patients hospitalized across our system. We will share that regionally so that you can see that as well. Okay, I see another question in. What's the recommendation for children after the holidays? Mask mandate, testing, etc.
So the CDC has released new information that is possible to use for children rather than quarantining once exposed. There is an alternative to twice weekly or once weekly testing in lieu of that quarantine. So that's something the CDC has discussed, but of course would be up to that school, the region, the state to determine what would be recommended in those settings.
All right, thank you. Another question from BR Proud. Do you plan on bringing back previous COVID-19 mitigations to the hospital?
So last week, we reinstated a number of those precautions that had previously been in place, including having everyone in the building go back to mask, including in meetings. Anyone who can work remote has been asked to continue to work remote and really utilize Zoom as a way to communicate in lieu of in-person meetings. So I would say most of those precautions are back in place at this time.
Thank you. See another question about how many COVID inpatients are y'all treating at Ochsner Lafayette General today, and how many flu inpatients?
10 COVID inpatients at Lafayette General.
Okay, and we do not have the number of flu inpatients, so we can follow up with that team. Another question, vaccine efficacy has been a concern to those vaccinated and unvaccinated. I believe Dr. Baumgarten touched on this a bit, but would she be able to reiterate on the vaccine effectiveness on the new strain?
Sure. So with the vaccines, the booster helps to increase the body's response in virus-producing antibodies to COVID. And so with Delta, we knew that with 2 vaccines, we had a good response and were able to keep people out of the hospital and from death by using those 2 vaccines. What we know with that 3rd booster is that that number is very similar to fighting antibodies with Omicron. So in the studies, Pfizer's booster shot increased people's levels of virus-fighting antibodies by 25-fold. And so that's very similar to what we would have been able to fight off Delta with. And that's very similar to Moderna. Moderna's antibody levels against Omicron increased 37-fold compared to pre-boost levels.
All right, thank you. I know we're running short on time. I know that Dawn touched on staffing already. I see another question about how big of a staffing shortage has this changed since the fourth wave of COVID?
Yeah, we've the challenges have continued to increase, I think, since the 4th wave. Like many across the country, people have chosen to go travel, and we've seen people really exit healthcare in general. And so the staffing challenges are real and have continued to get worse through the second part of the year. So again, we are working to be as proactive as possible to bring people in and do everything we can to make sure that we're getting the right people to the bedside to take care of patients and also to retain the staff we have.
Thank you, Dawn. I saw another question about how many COVID-19 patients are being treated in Monroe. We have that number for North Louisiana, which is a combination as both our Shreveport and Monroe facilities. That total is 8. We can follow up with that team.
Hey, Nicole, I
have
just
it, Dawn?
pulled. Yeah, I just
Oh,
pulled
okay.
it. Between it's Shreveport and St. Mary, there's a total of 8. Monroe actually is 0.
Okay, thank you. Okay, see another question. This is more opinion-based, but since there is a new strain, do you believe there will be an incline in the amount of people getting vaxxed?
I hope there will be an increase in the number of people getting vaccinated. And we have seen that we have more people attending our vaccine clinics across our system. So that's a good sign. We would like to see a ton more, of course. We want to encourage everybody to get vaccinated and boosted as soon as possible, sooner rather than later. Go out today, go out tomorrow, get your vaccine, bring somebody with you to get their vaccine and get boosted. So yes, we are seeing a slight increase in number of vaccinations, but it's just not enough.
Thank you. All right, another question. Should the governor reinstitute a mask mandate?
So we don't need a mandate to wear masks, and we do know the data supports mask use. We know that it prevents you from getting infected, it prevents you from spreading infection, and we also know that COVID can be transmitted in those that are asymptomatic. So we don't need a mask mandate to wear a mask. We don't need a mask mandate to encourage others to wear a mask. So that's the best advice we can give to be sure that we're keeping everybody safe across the holiday season.
Thank you, Dr. Baumgarten. Well, we're at 3:43, and I know we've gone through a lot of questions. Does anyone else have a final question for us this afternoon? All right. Well, thank you, everyone.